10 common mistakes that every pregnant woman should avoid. The pregnancy experience is one of the greatest gifts God has bestowed upon women. During this time, you may need to make some sacrifices for your unborn child, but they will be well worth it. At all times, you and your child's health must be considered. Some of your favorite things may have to be sacrificed during your pregnancy. Others may be hard to give up, despite the fact that some of them may be harmful to your health. Women who are pregnant should avoid or limit a number of things during their pregnancy. We have compiled a list of items or workouts that you should avoid or use with caution in this post. Number 1. Carrying groceries. It's acceptable to carry grocery bags as long as you only carry a pack of cheese, milk, bread, or eggs, especially if you're in your 3rd trimester. Carrying a 5 or 6 kilogram grocery bag is too much for you. Your water bag can burst if you carry a lot of weight, leading to premature contractions and other complications. Number 2. Laying down straight. Lie flat on your back. Many people avoid lying flat on their back because they believe it to be too risky to do so. Nevertheless, lying flat places an excessive amount of pressure on the heart, lungs, and kidneys, as well as limiting blood flow from the lower to the upper body. The infant would be less likely to receive nutrition and blood as a result. Number 3. Carrying your toddler. You may find it difficult to take care of one child while pregnant with another. During pregnancy, lifting your child frequently and for extended periods of time can place a burden on your baby. You should sit down and lift your toddler up without bending her waist if you need to carry her. Keep her from holding your hand for too long. Number 4. Not wearing your seat belts. Some women avoid using seat belts since they believe the belt would hurt their children. Be sure to buckle up regularly if you plan on traveling frequently. It is possible for an accident to be even more dangerous for the fetus than the mother. Number 5. Slouching on a couch. As your belly swells and your center of gravity shifts, you may slouch on your couch. There are a few reasons why you should be aware of your posture, however. Pregnant women can experience lower back pain, hip pain, and pelvic pain due to poor posture. Number 6. Wearing high heels. Pregnant women should avoid wearing high heels. Flip-flops or flats are a better alternative to stilettos. The body releases relaxin during pregnancy, a hormone that loosens the joints. A woman's stomach swells and gains weight when she is overweight, making it harder to balance on high heels. The risk of falling or slipping increases during this time. Number 7. Using your smartphone. Overusing your smartphone. While we can't imagine life without our phones, we know electromagnetic waves can be dangerous to the fetus. As a result, limit your use. Keep it away from bedtime and only use it in an emergency situation. Put an end to playing Pokemon Go every day. Number 8. Watching horror movies. Seeing too many horror films? If you're not afraid, keep watching. However, if the afterthoughts worry you, it may be distressing for your child as well, so stay away from such depressing films. Number 9. Bending down. You may experience shock and pressure in your abdomen when you bend down to pick something up. Keep in mind that you shouldn't apply pressure to your abdomen while you are pregnant. Number 10. Oversleeping. Sleeping too much during pregnancy is not a good idea. Getting enough sleep is essential, but sleeping too much can make you sluggish. To get the most out of your sleep, aim for 8 to 9 hours a night. If your doctor recommends bed rest, do not sleep more than that. Additional things. Avoid alcohol. During pregnancy, you should avoid alcohol, among other things. Even though a small amount may not cause much harm, too much can cause serious health problems for mother and child. The alcohol you consume contaminates your bloodstream. The alcohol can penetrate the placenta and reach your baby if you drink while pregnant. It cannot be digested as fast by the developing liver of the infant. Avoid drugs. Drugs are already extremely detrimental to the human body's normal functioning. When you have a baby inside you to look after, they become risky. Your baby will take every medicine you take. Because drugs cross the placenta, you are sending them down to your kid if you use cannabis, ketamine, ecstasy, cocaine, or any other illegal drug. Pregnancy problems and fetal abnormalities are greatly increased as a result of this. Food to avoid. During the first trimester of pregnancy, there is a broad list of foods and things to avoid. Certain varieties of cheese, shellfish, and most seafoods, as well as rare steaks and caffeine, have been shown to be harmful to pregnant women. Bacteria-containing foods should be avoided since they might cause infections and, in the worst-case scenario, miscarriage, stillbirth, or illness in your baby. In this phase, moderation is more important than abstinence. You should be aware of the dangers and take the appropriate safeguards.